forget what I was saying as I was saying it.
Struggling for most of her life with an undiagnosed condition.
Couldn't even unload the top rack of the dishwasher without breaking a sweat and being absolutely exhausted and needing a nap.
Constantly nauseous with severe headaches.
You know, I had the whole routine. I had a cup right by my desk, you know, that I could throw up into in case I got nauseous.
Sally McConnell says she was infected in Kelowna when she was just 6 years old, a bite she still remembers today. But it wasn't until after a dozen doctors and 28 years later she learned she had Lyme disease.
You don't know how many times I was referred to psychologists and psychiatrists because they thought it was psychosomatic.
A couple of years ago, McConnell happened to be referred to Dr. Ralph Hawkins, and she started to get answers.
I cried and hugged him. I was so overwhelmed with joy to actually know what was wrong with me.
He's one of a few Canadian specialists in internal medicine treating Lyme disease. Since taking on his first Lyme disease patient, Hawkins has treated hundreds of Canadians. His wait list is now 2 years long.
The alternative to traveling to Calgary for many of these patients would be traveling to specialty clinics in the United States.
He treats the infection with antibiotics, but for longer than what's usually prescribed, sometimes up to a year.
I think what has happened in Canada is we've ended up with very narrow guidelines. It concerns me when I see a one-size-fits-all guideline-based approach.
The guideline for treating Lyme disease in Alberta is 3 weeks of antibiotics. Alberta Health says there is no plan to revisit that recommendation.
In general, it's quite appropriate, and that's what the guidelines do, is that it covers most of the situations, and so most of the time it fits well, and sometimes you need to adapt, and that's quite acceptable too.
McConnell says after 2 years of intense treatment, she's finally pain-free.
I can't even explain how much better I feel. I do have to pinch myself most days.
A welcome thought and perhaps a glimmer of hope for others still struggling. Kim Smith, Global News.